Thank you. All excellent presentations. I think that rage and hope turn into enthusiasm, a very strong entrepreneurial spirit, and the desire to learn from each other. I have a question before moving to the table discussion for all of you. When we work with population groups who are potentially underserved or marginalized, it's often easy to fall into the frame of we helping them. But I would like to ask you, how are they helping us learn skills, a way of working that can be applied not only to other potentially marginalized and underserved groups in Canada, but to the whole Canadian society, given the increasing level of complexity we were discussing earlier?
Well, just in terms of language, I feel like what they've helped me do is simplify my language so that when I'm working in my other practice, which deals with low-income Calgarians, but most of them are Canadian-born, it's enabled me to explain medical diagnoses and management in a much more simplified way. Like, I find they've really helped with communication skills.
I mean, it's probably cliche to say, but the first thing that pops to mind is just being inspired by the resilience of the patients that we work with. I mean, the ability for them to overcome and adapt to just the most horrific scenarios, and then also coming and dealing with incredible challenges in terms of language and not understanding the culture, and yet all of a sudden have housing, a job, and be better off than like some of my best friends I went to high school with. And it's just so inspiring to be able to see what they are. And so it does give you a different framework on the way you see the world in terms of your ability to overcome challenges. And so it's kind of a bit pie in the sky, but.
Yeah, I mean, I would echo that. I think we all do this work partly because the medicine is interesting, but I think more than anything, it is the stories and the real testimony to human resiliency. I mean, as you hear what people have endured, it's hard to imagine any of us could live through that and survive, saying nothing about, starting again and flourishing. I would say, though, in terms of as we're thinking about policy and how we, make lives better for clinicians, but particularly the people we serve, I don't know how we could do it without being grounded by the populations that we serve. So I'll give you just one example. I am on record. It's on the internet. I think I was asked to testify in front of the Senate about changes that happened to refugee processing like 6-7 years ago, where the previous government made a commitment to process people faster. So, many of us didn't like that. So it went from about 1.5 years, and the commitment was 60 to 90 days. They never reached that. I mean, there was some practical implications, but I'm on the record critiquing that. Anyway, all my patients said they would prefer it, right? They wanted to be processed faster. And that's not to say that 60, 90 days was accurate, but again, it was a bit of a reminder that perhaps I got that wrong or I overstated it. And, I don't know about the rest of you, but that probably happens every day in my life, right? There's assumptions I make that I'm always having to recalibrate. And, I think for the policy people out there who aren't guided by looking into the eyes of the people that we're serving, I think it must be a tremendous challenge, right? We all have our assumptions that need to be checked, and I think that's really what our patients do for us. So.